Good evening. It has been an exciting time with all the conversations that I've had so far, and I've met so many industry stalwarts. eClinicalWorks has been number one when it comes to changing the healthcare portfolio for any clinic, pharmacy, lab, or an hospital. We want to talk about Sunoh.ai, which is our first conversational AI product, and I'm going to be doing a live demo. Before I do that, we want to go through a quick presentation defining who we are, where we come from, and our current presence in the Indian market. We've been a private company based out of US since 1999. We have more than 180,000 doctors that use our product at this point of time. We've stayed private, made sure that our passion to innovate in healthcare stays on the top. We have global customer presence in 42 countries. In India, we have offices in Ahmedabad, Mumbai, and Bangalore with more than 5,000 employees. Most widely used EHR. 180,000 doctors actually use our product day in and day out. We control 36% of the US's healthcare market at this point of time. The India story started back in 2013, and that's when we started understanding how India works. I was a localite. I came back to Ahmedabad. I was in Boston, which is where the headquarters was, for 10 years. And that's when we started building the product, stitching the product by working with local hospitals. In HMIS, we have now 35 plus modules, and we handle 500 plus hospitals in India across 24 states at this point of time. We might be the only company who have achieved partner relationship with the National Health Authority. You can see our name under HMIS, LMIS, every product that ABDM has on their website. We handle 30,000 plus beds. Importantly, our solutions can be deployed from 5 beds to 2,000 plus beds hospital on a single database as a web-based version. Some of our big customers that we have deployed across India, we do a lot with the teaching institutes, which is why you see Gujarat Cancer Society, the Jivraj Mehta Hospital, Sagar Hospital, and even Parul Hospital. All of our deployments, we would say more than 90% of our deployments as of today are on Microsoft Azure. So we are a true web-based cloud hosting solution partner. All the solutions that we have, which can make a hospital or a clinic truly digital, are basically starting from Opera, which is outpatients records application, which is utilized by the doctors in the outpatient scenario. We have the hospital management information system, which has more than 38 plus modules. We have also launched the true inpatient suite of products recently, which can actually make a hospital paperless. And on the patient side, we have a company which is Hilo. We call it as Health and Online Wellness. And those are, we do patient portals, we do applications for patient under the Hilo umbrella. So we truly basically call ourselves as one-stop solution for any clinic or a hospital. Today, I take pride in announcing that we are launching Sunoh.ai. This is the first ambient listening conversational product which will be offered to India. We have started with pilots before 7 days to current customers that we have, and we really wanted to actually show it to you and not just go through a PPT. So I'm going to invite my colleague Miraj, who is going to act as a patient. We will do a live demo of an actual doctor-patient scenario, and after that we'll take some queries or questions from your side. Quickly, yes, we have recently bagged a very reputed award to implement a futuristic, it goes with the line of the particular event that we are into, building the smart digital hospitals. IISc wants to be the first fast digital hospital. eClinicalWorks is going to deploy the solutions at IISc. Again, in compliance, we make sure that we are a 100% compliant product. We go through every certification that is required legally and by law. So we would like to actually start with a demo now, and It is going to be a multi-conversational demo, where a doctor can actually talk with the patient in English and Hindi, and we are also going to launch some regional languages. But we want to really show you the power of AI. We really think that the doctors need the time with the patient. They don't have to spend their time by logging into an EHR product or by documenting the patient's diagnosis, symptoms, or medications which are given. Okay, over here, I'm going to act as a doctor. Miraj, my colleague, is going to act as a patient. This is the actual doctor's cell phone. It can also be an app which can be deployed on a tablet or a laptop or a desktop in a browser version. We have just logged into this particular application. It's Sunoh.ai. Now, the doctor literally has to click on start recording when the patient sees or when the patient is actually in the doctor's room. The doctor literally clicks on start recording. This is exactly when the app, Sunoh, connects to our AI servers on Microsoft Azure. Miraj, कैसे आना हुआ आज?
डॉक्टर 2 दिन से थोड़ा तबीयत ऑफ चल रहा है, पीठ में थोड़ा पेन है जो पीछे की तरफ जा रहा है, और यूरिन के समय थोड़ा बर्निंग सेंसेशन है, और आज थोड़ा ज़्यादा हो गया जहाँ पे मुझे यूरिन में ब्लड दिखा. सो अभी लगा कि डॉक्टर को मुझे दिखाना चाहिए.
नो प्रॉब्लम, मैं तुम्हें एग्जामिन करता हूँ, बट लेट मी आस्क यू सम क्वेश्चंस. एनी अदर सिम्टम्स यू हैव फेल्ट बिफोर, लाइक आपको उल्टियाँ हुई है, आपको कोई बुखार था लास्ट नाइट?
हाँ डॉक्टर, मुझे बुखार था कल रात को. मैंने डोलो 650 mg लिया था, उसके बाद बुखार नहीं आया मुझे.
अच्छा, लेट मी ऑल्सो आस्क यू, एनी अदर फैमिली मेम्बर्स हैव सिमिलर सिम्टम्स दैट यू हैव नोटिस्ड?
नो डॉक्टर, फैमिली में किसी को ऐसा कुछ पहले हुआ नहीं है, बट हाँ मेरी फैमिली में मेरी मदर को डायबिटीज़ है और फादर को हाइपरटेंशन की हिस्ट्री है.
Thank you for letting me know of the history. Well, I am, Miraj, looking at your current, blood sugar, the random blood sugar. It is 241, so you should really take care of yourself. Lifestyle change karo, look into a proper balanced diet. Your vitals are normal, 120/80. I'm not worried about that. Allergies है क्या आपको अभी कोई?
मुझे डस्ट एलर्जी है, सो कभी मुझे स्नीजिंग होती है व्हेन आई एम एक्सपोज टू डस्ट.
अच्छा, वेल दिस इज कॉमन. अभी थोड़ा सा वायरल चल रहा है अपने सिटी में, तो ये हो सकता है. व्हाई डोंट आई जस्ट प्रिस्क्राइब यू सम मेडिकेशंस. यू कैन स्टार्ट विथ लेवोफ्लेक्सिन, एक्वाजाइड, एंड आपने बोला आप डोलो तो अभी ले रहे हो, राइट? ओके, एट द सेम टाइम व्हाई डोंट वी ऑल्सो ऑर्डर सम लैब्स. I will order you a CBC, I will order a urine test, and let's also do an ultrasound KUB for your kidneys and uterus, so I can have a better look into your. It looks like kidney stone to me, Miraj. शायद kidney stone हो सकता है इसमें.
Okay, doctor.
पर आप ये टेस्ट कराइए, आप ये medication लीजिए, and why don't we meet each other in the next 2 days as a follow-up?
ठीक है डॉक्टर.
Great. The doctor literally clicks on stop and summarize. This is a normal conversation that happens between a patient and a doctor, and the note is getting generated right now. When you see the blinking note next to the timestamp for Miraj, this is exactly when AI kicks in. The AI saw the conversation, it heard the conversation. As you can see, it was multilingual. मैं इंग्लिश में बात कर रहा हूँ, मैं हिंदी में भी बात कर रहा हूँ. At the same time, you can have multi-party as well. So the note just got created. I'm going to click on the note to give you an idea how the note got created right now. As you can see, the note just got created. I'm going to read it through for some of the people in the back. It says, Aakash Shah is a 39-year-old male who presents with back pain, burning urination, and blood in his urine. He denies nausea or fever. His family history includes diabetes and hypertension. His random blood sugar is 241, indicating poor diabetes control. He sneezes when exposed to dust, suggesting an allergy. I suspect a kidney stone and I've ordered a CBC, urine test, and an ultrasound KUB. I prescribed a levoflexin and dolo for symptom relief. The patient should follow up in the next 2 days. So it takes an entire HPI, which is history of present illness. अगर आपने current medication discuss किए, then the soap note will also have that. Medical history discuss किए तो वो आ जाएगी यहाँ पे. Allergies, as we discussed, dust and sneezing. No hospitalization. Family history, Mirat said that my mother had diabetes and father hypertension. The note actually captured that. We talked about vitals. It has a blood pressure of 120 on 80. It took a note of that. Importantly, assessments with ICD-9 codes. Calculus of kidney. The doctor basically said that I suspect kidney stone. It picks up the assessment and attaches the ICD-9 code to it. Type 2 diabetes mellitus without complications. Essential hypertension, other allergy status, other than to drugs and biological substances. It also gives you a detail of a treatment plan. You can just go through it really quick. It will have a detailed treatment plan जो patient और provider और doctor के बीच में बात हो रही थी. It also has details of medications that the doctor has prescribed, which is the levoflexin and dolo. Labs, CBC and the urine test that the doctor just talked about. Any diagnostic imaging, I talked about having an ultrasound QB. It took that and put it in the structured format in the SOAP note. And the instructions to the patient are very clear. Start taking the medications, undergo an ultrasound, follow up in the next 2 days. You know, this we really call this as a power of AI. We don't really think that the doctor should actually log into an EHR and actually give time in writing the entire SOAP note. Their job is to actually, give the touch and the feel to the patient that they are seeing. This can easily save more than 2 to 3 hours of a doctor's time. Importantly, we will give an edit functionality over here so that the doctor can edit anything that they want to. यहाँ से आप copy to clipboard कर पे आप paste कर सकते हो instructions. You can do an API integration with your HMIs. You don't have to change your software. This is the true conversational AI according to us. This product we launched in US before 15 months. We could deploy to 65,000 doctors of our current customers. We use LLMs which are created on our own. We use very, very complicated Microsoft AI stack and ChatGPT's licensed versions to do it. We deploy this right on Microsoft Azure, and we want to give this out as a pilot for 30 months to any doctor who is present in the room here. We really would like you to test it out, give us the feedback. We really think this is a powerful tool to save important time for the doctors. And now I think I'll open up for Q&A. Any questions on the presentation that we've done so far? Importantly, on Sunoh, the conversational AI product. Yes, sir. Currently, sir, because we are deploying this on Microsoft Azure, you don't have to worry about your client, you don't have to worry about your any server deployment. We have an introductory price of 5,000 rupees per doctor per month. And if there are more than 10 doctors, we will come down on the pricing. So this is just an app. You can install it on your phone, on your tablet. You can carry it with you. You might be working as a visiting doctor at somewhere else. You still can keep recording your patient's data. No, this is the question, can this be used for reports dictation? No, this is only your conversation recording between a patient and a doctor. So this is two-way. Perfect, that's a very good question. So Sunoh was designed as a multi-model. I'll give you an example. I'll be the doctor. I'm a pediatrics doctor. I have a child who is visiting me for a symptom, and the child has a parent, like a father and a mother, who are actually asking questions in between, or they're talking about the child's regular schedule at the school or classes. It understands the conversation very smartly as who is the patient, who is the doctor. So to answer a question, ma'am, any conversations which are happening behind will not get recorded, and it understands this is not the clinical information. It should not be recorded. because your voice as a doctor will be trained before you start using the system.
So if there is an emergency room and a casualty,
Yes.
sometimes the resident doctor, because I can assume that the fastest speed in the casualty will help, for such kind of a Sunoh thing.
Correct.
So if there is one patient they're examining, so this RMO or this emergency ER person with the patient is one, but sometimes on the next bed there's somebody speaking. Will this hold only this conversation?
100%, it is tested.
So depending on the distance and a separate conversation, that will not be logged into this conversation into the gadget.
Exactly, yes.
Okay.
Which is why I'm saying you can actually use it for a month as a pilot, use it in your ER rooms, use it in your outpatient settings, and it will actually give you the accuracy of how it is processing the results.
Does it require any noise cancellation mic or anything, any hardware?
It does not, no. It does not require any noise cancellation. In fact, I'll give you an example. Outside we have a stall, we have a booth, and there are many people who will be talking around you. You can act as a doctor, you can act as a patient, and with all the noise around us, it will still give you a very, very accurate AI note.
And can we edit what is coming up?
Yes, you can edit it.
Because there are sometimes conversations we don't want to put on paper.
Oh, 100%. We are going to give you the edit functionality in this entire node. So once you are done looking at the patient's diagnosis, if you want to remove something, you can.
But if the patient has the same app, can he then record it as the actual conversation?
No, this is only for doctors.
I understand. But if supposing I'm a patient also, I can also use the same, and then my data, which I have recorded and saved with me, and the doctor's data, as the doctor's recorded and saved, will not match. So my medical-legal dilemma, I'm just asking, just my thought. What will happen is I will have information that the doctor has said. I'm saying it in the perspective of, say, abortion or some privacy conversation, wherein we've had sometimes said things which we don't want to document. So we speak, but we don't document.
Correct.
Now, if that happens and are two people who are recording that conversation, what happens then?
See, it understands the doctor.
I meant to say is when I'm having this conversation, can I see that no other device can pick the same conversation? Can I block any other device in the room?
That's a good feedback. I'll take it and see, if we can do that.
Okay.
Yeah.
That start Dolo or start this such type of medicines and all these things.
Correct.
But if we say that take Dolo for twice a day after food, will it pick up?
100%.
But that will act as a prescription to that.
And then you can take that particular portion and send it to the pharmacy or send it on a WhatsApp to the patient.
Okay, but so that this app should be connected to the pharmacy also then, because
in a hospital setting we can connect the app. Yes, in a hospital setting or a clinic setting, if you want us to connect the app to your local pharmacy, we can do that.
Yes, because there should be some authenticity, because it is an AI. So
Correct.
Everywhere the prescription will not be entertained.
100%, yes.
So on medical legal grounds, what we have to check out regarding the prescription.
So we are ISO 27001 certified as well, and we are keeping an eye on everything that we can do legally over here. Okay. You can be an orthopedic surgeon, you can be an ENT specialist, you can be a GP. You can start using Sunoh, and we are using very, very sophisticated Microsoft stack of AI. We see there's so many other products in the market, and when you compare it, which is why we say, please use it for 30 days and you will see the accuracy. And it can be any specialty, you can use it. Well, these are some newer products which are launched. It does not require an approval at this point of time. The doctors are using HMIS softwares to enter the data at this point of time, and they're doing it manually. This is only a tool to save doctors' time, and it can attach a note to your current HMIS. It is only helping the doctors so that they don't have to worry about, writing the entire progress note on their own. No, it is not suggesting you the medications. It is only talking about the medications the doctor is actually giving to the patient. Yes.
So I can see one more application. So we are an ambulance aggregator company. So while transporting the patient, we also does the live vital monitoring to the ER room. So how can I think we use this kind of software in ambulances? Because in ambulance also there is a conversation between EMT and doctor. So can we use this in that particular application?
I will have to think about it. Why don't we just meet outside at the stall? I'll have to understand the business requirement. If possible, yes, if the technology is made.
Okay.
Yes.
Yeah, because I think we are already connecting with the ER doctor from the ambulances. And the patient and EMT in the ambulance, they are already talking to the doctor with video and audio.
Sure. We can have a deeper conversation outside, sir.
Okay. Thank you.
Thanks. Yeah.
In light of data privacy and the DPDP Act of the Government of India, this conversation that you are referring to between a doctor and a patient, how long will it remain on the system, and does it have any implication in case of data privacy?
Well, we record the exact transcript, which is Q&A, question by the doctor, answer by the patient, and that transcript stays forever. The audio conversation stays for 7 days, and if certain clinics or doctors have a longer requirement, we can look into it. It only adds to the storage on the Microsoft data center side, so that's the only thing that we have to look into. Okay, well, thank you so much for the time. We are really delighted to launch this product. I think we have a last question. We think we have
maybe a few of them. So language-wise, you spoke about English and Hindi. Is it supporting other dialects as well?
We have started working on Marathi, Kannada, Tamil, and Gujarati at this point of time.
Okay, how about the accuracy of the output?
It is, I would say it is 99% accurate. The more the doctor uses, it gets trained on its own. At the end of the day,
LLM training kind of
100%, yes.
Okay. Are you thinking of applying any CDSS on top of this and having a differential diagnosis?
We can do a clinical decision on the top of it, but the way we are thinking is, this is only a tool which is helping a doctor. In the end, this note should be given out or should be integrated with your HMIS or your clinical module, and that software should have the CDSS. Well, we are excited. Yes, sir. I think we are done. Thank you so much for the time, and thank you so much for everything. You can play the AV, please.